In response to COVID-19, the government of Belize has implemented strict guidelines on persons to practice social distancing to reduce the spread and risk of getting COVID-19. Practicing social distancing is when one maintains a greater than usual distance away from another person. In public health, it is a practice to prevent sick persons from coming in close contact with healthy people. Recent studies are showing that social distance of 3 feet or more decreases the exposure of COVID-19. Before these restrictions, a person with COVID-19 could infect 2.5 persons in 5 days, 406 persons in 30 days. When you put into practice measures to reduce the exposure activities by half of that one infected person, in 5 days you would possibly only infect 1.25, 30 days, 15 persons. Reduce the exposure of that infected person by 75%, in 5 days you infect 0.625, in 30 days 2.5 persons. Remember,
good, we're ready to go. Waiting for the signal. Okay. Good morning, members of the media. Good morning, members of the public. Welcome to this, my first virtual press conference. I have prepared a script, a formal statement that I wish, first of all, to read. When I'm done with that, I will ask Dr. George Goff, the CEO of the Ministry of Health, to update you, and when he is finished, we will both take your questions, as many of your questions as are necessary for us to fully ventilate all your concerns. So let me begin with a prepared statement. Today marks something of a milestone in our national campaign against COVID-19. The first state of emergency proclaimed by His Excellency the Governor General expires at midnight tonight. And this is also, I believe, the 17th straight day that we have gone without recording any new positive case. We therefore are turning a corner, and at 12:01 a.m. on Friday, May 1st, a new or extended state of emergency goes into effect. That means there will be, in effect, a new proclamation issued by the Governor General. Thereunder, there will also be a new statutory instrument with new regulations that His Excellency will also sign into law. The new state of emergency and the new regulations will, as mandated by the National Assembly, last for 60 days unless sooner revoked by Parliament. The principal reason for this press conference is to sketch for you the changes that the new regulations will effect. I use the word sketch advisedly. All I will do is to highlight some of the new features that the new regulations will usher in. Later on today, it is the Attorney General that will walk the public step by step through every provision of the new statutory instrument. That statutory instrument will, of course, also be available on various GOB websites and generally on social media. In Parliament and elsewhere, I had made the point that there was no need to fear that the extension of the state of emergency necessarily meant the extension of the regime in all its rigor that existed under the previous state of emergency. In fact, I signaled that, given how comparatively well we are doing in keeping new cases at bay, we expected to relax the strictness of the last set of regulations. I'm therefore here to tell you this morning that it is precisely as I intimated. There is a substantial easing that the new regime will bring. I'm also pleased to be able to say that the new measures are the product of an agreement between both the National Oversight Committee and the Cabinet of Belize. Before I go any further, I must make one thing clear. There is no way, in those famous words of President Bush, that we can declare mission accomplished. We see what is happening now as a breathing space, a somewhat uneasy truce. We will use the opportunity to plan, to prepare for the distinct possibility of a second wave of cases. If that hits, we ask our people to be ready to do it all over again, including returning to the most draconian of lockdowns. One of the worst things about this virus is that nobody in the world has been able to figure out exactly how it works. It is an unpredictable, insidious enemy that can double back on itself and quickly upend whatever progress we initially make. This is a long-haul struggle, and we will no doubt have to make long-haul sacrifices. For now, though, we believe we have caught a little bit of a break, however short-lived it may prove. We therefore seize the opportunity to restart, to the maximum degree possible in the circumstances, internal business and economic activity. Accordingly, under the new SI, all government departments and all statutory bodies will reopen on Monday, May 4th. We have, naturally, added to the list of approved private sector businesses also permitted to operate. And those add-ons can actually begin on Saturday, 1st May, after the Labor Day holiday, if they normally employ Saturday opening hours. Lawyers, accountants, real estate brokers are some examples of private sector professional service providers that are now on the approved list. There is as well a category compendiously described as local manufacturers, under which our carpenters, building contractors, plumbers, electricians, and so on will also be able to operate. The wholesalers and retailers generally are being freed up, and even call centers can reopen, particularly for training purposes. Belize call center services are increasingly in demand as a result of the pandemic, and the centers can take on well over 1,000 new hires if training is allowed. Very, very significant for the economy. Hotels will also now reopen, if they so choose, to cater to a Belizean clientele. Their restaurants will be limited, though, to providing room service and take-out meals. As a result of all this, the general restriction on movement is being lifted to the extent that it will now permit the public to attend at the various government and private businesses for such services as they require, in addition to the purchase of supplies and essential needs. And in one more concession, beauty salons and barber shops can also resume operations, although only on a by appointment basis, dealing with one customer at a time. Spas, I am afraid, still will have to remain closed. There is much more to the statutory instrument than I have outlined. But as I said, I leave the detailed line-by-line exegesis to the Attorney General, whom you will see later today. I therefore have only one other thing to add in this regard. The relaxation, the opening up, is not a free-for-all. Every business activity, all economic operations are subject to the social distancing requirements. No public establishment can suffer any member of the public to enter its premises without wearing a face mask. And managers and staff must themselves wear the masks. Also, none can operate without putting in place the 6-foot dividers to keep both staff and the public properly spaced. It is then critically important for us to grasp that ultimately everything depends on our observing the physical distancing and other rules. Thus it is that we are actually increasing the penalties for particular breaches. As just one example, those caught using the illegal crossings to go especially into Mexico and Quintana Roo, where the proliferation of coronavirus cases has skyrocketed, will, upon conviction, go straight to jail for 3 months. A second conviction will result in a 1-year prison sentence. I wish to stress again that this breather that we're taking is an opportunity to ramp up our defenses for the possible second wave. Key to that strategy is continued testing. It is for that reason that CEO Dr. Goff is here. He will go over our inventory of tests and accompanying supplies that are in hand and what is on order. This is for one overriding reason: transparency. You must know our state of readiness. You must know of any shortcomings and what we're doing to fix those. You must know what money has been spent and how it has been spent. You must know our funding sources and what has been promised versus what has been received. Before I turn it over to Dr. Goff, I will say one last thing. We are all hoping soon for the internationally certified rapid tests that will help us to do 2 things: increase our own local testing capacity and enable us effectively to test visitors so that we can reopen our all-important tourism industry. In the meantime, though, let us understand something. We will never be able to test every single Belizean. Furthermore, the science suggests that that is simply not necessary. What the international benchmarks from the WHO and others say is that there is no exact number of tests to aim for. The guiding principle, rather, is this: you want a low percentage of your tests to come back negative, around 10% or even lower, says William Hanage, an epidemiologist at Harvard. This is because if a high percentage of tests comes back positive, it is clear there is not enough testing to capture all of the infected people in the community. The lower the percentage of tests you are doing that comes back positive, the better. By that standard, Belize, with only the cases that we have documented from over 700 tests, is doing well percentage-wise. We're certainly well below that 10% positive benchmark that signals the need for greatly accelerated testing. Also, at the beginning of an outbreak where the number of people infected with the virus is low, a much smaller number of tests is needed to accurately assess the spread of the virus. As the virus infects more people, testing coverage needs to expand in order to provide a reliable number of the true indication of infected people. All that notwithstanding, Belize is moving on with increased testing, as Dr. Goff, to whom I now turn, will explain. The screen has gone blank. I'm not sure if members of the media are still tuned in. If they are, let me move across so that Dr. Goff can take my place for the moment.
Good morning, Prime Minister. Good morning, Belize. Good morning, colleagues. Good morning, Belize. The Prime Minister asked me to give a quick explanation of what has been happening in procurement for the Ministry of Health. I think that we have to go back from January, that we were aware that COVID was going to be on our doors. The Ministry of Health usually procures for a period of 18 months. So that gives us a surplus between 3 to 6 months at times in certain items. Where we have to be mindful of, the COVID-related items were items that were not considered the principal items on the market until COVID came on the scene, like masks. We used to buy a mask for 0.04 cents. The cheapest I can find now is 74 cents Belize, to give you an idea. PPEs were only used in the continent of Africa for the contagious diseases like Ebola. You could buy them for little of $3-4 a set. They have been up as high as 60 Belize dollars individually. And I can go on. So to be more concise, there are about 9 items that were related to COVID that skyrocketed, I would want to say 6,000 to 7,000%. And that's an understatement in certain items because of the demand. A ventilator, you could negotiate a good ventilator. Now you're getting the ones that the world was not buying 2 years ago on unnegotiated prices. So what am I trying to say? I'm trying to say that we had a surplus when it came to gloves. We had a surplus when it came to certain gowns. We had a surplus when it came to certain masks. That gave us the time in January to start to look at sources, to start to procure. The Ministry of Health, through the resourceful administration from Ministry of Finance, they started to look at the problem seriously in the month of March, where we were ending the fiscal year. And did they make provisions for us to get small quantities of monies to be able to start to procure at least the 9 items that we were going to need, like ventilators, masks, gongs, PPEs, soap, alcohol, Clorox. And as you all have become experts, I'm sure, in COVID, you all can tell me the rest of the list. With that said, orders were put in time, I would want to say, because we knew bottlenecks were going to come, and these orders would take up time between 4 to 6 weeks. So with that being done, we started to procure quietly from 6 or 7 of the providers or national providers that have been with us the last 12, 15, 18 years. These providers obviously had the capacity to be able to put an order in without asking us for monies up front, because that's how the national procurement system works. We run what we call a Walmart system. They have to win their tender, they have to go through a procurement, they go through the procurement process, they order it, and once it arrives, they store it at their warehouse, and until we use it, until we draw down on it, we pay them. Sounds a bit unfair, but that's how the tendering system works. So we put some of that decade of trust into about 6 of them, the ones that had financial capacity to support us. With that said and done, we were able to secure close to $6 million worth of supplies, divided in about 9 or 10 suppliers. We were able to share our risks. We did not give one supplier one only item, one only quantity. We spread the same item between 3-4 suppliers because we wanted to make sure that it trickled in from all sides. With that said and done, we have only committed so far $6 million. We have managed to pay close to 3.8 from the government's coffers. We're still outstanding about 2.4. We have managed to receive in country about 80% of that stock. There's a spreadsheet that I provided to the Ministry of Finance last week, updated this week. It's constantly updated based on when Hyde shipping comes in, when Amerijet comes in. And we have been able to at least secure 80%. Now, where I'm being careful here, this $6 million and this 80% that of this $6 million that we have in country for these 15, 18 items COVID related, I would not want to say that it is the final purchase that we will have to make. I must agree with the Prime Minister that the first wave, if we are blessed not to have a case by the 11th of May, I stand corrected, then we would be able to say 28 days have passed, and we will be able to say we have gotten out of the first wave. But you all as known historically in around us, countries are going through the second and third wave already. So now where are we? Presently, we have in the country, I would want to say, enough liquid soap, enough medical liquid soap, we have enough alcohol, we have enough peroxide, we have enough Clorox. Why am I saying these? These are enough glycerin, these are the components that we use to make hand sanitizer, these are the components we use to clean our hospitals, these are the components that we need to be able to encourage personal hygiene, especially between the essential workers, between the ministries, between the schools, the universities. We have managed to amass in our warehouses gloves and masks. I know there have been complaints that I have been a bit locked down, and I must say, because when the media and the government and the private sector will have their own perspective or opinions, or sometimes we have common opinions, it creates demand on my masks and my gloves within the health system, because it comes to the point that I'm the only one that have it. So when we distribute it, sometimes we lose material in institutions that we don't even have a single COVID case. Now you can leave that for its own interpretation. So we have been very diligent in how we share this material, and that's where sometimes the complaint from my staff will come that they don't have this, they don't have that. And maybe what happens is sometimes it doesn't trickle down to them. It's in the institution. Probably it's under a more secure environment than it usually is. But that I make no apologies for, because I'm tasked to be able to take care of this material. When it comes to the basic stuff like the PPEs, we started with a stock of about 4,500 units. We had about 1,000 donated with us, and then another donor gave us another 1,000. We had ordered long before in March 6,000, which I am pleased to say that we've been discharging them now off the container yesterday. That has been put in country, again not to be distributed madly. And we presently have 15,000 more airlifted and 15,000 on order. All of this to the sum of almost $2 million Belize dollars. Now I don't want to say enough, because the Minister of Health of Ecuador said it's never enough when you get hit. I would want to say, like the Prime Minister just said, it's the calm, it gives us time to prepare. We have been also purchasing our components for our laboratory. This has its own unique structure, and I know this has led to a bit of confusion, even to myself. And at times I'm even afraid to give a report, because things change so quickly. What we are buying, how we're paying, how we're procuring, how it's coming, how we're using it. It is a nightmare when it comes to the logistic structure of it. But what can I safely tell you? Presently in Belize, like the Prime Minister said, we are tested more statistically and per capita than any country in the region. Secondly, we are blessed with the mere fact that we have stood our ground full circle to use the PCR machine, which confirms. We are not using the rapid test yet, because there are about 250 different models out there, none vetted as yet by the FDA in the US. As you all know, these rapid tests carry about 15% false, the false negative ones, the ones that will come out that they're positive and they're walking around and they test as negative, to put it in layman's term. What we have done with the PCR, we have secured a second machine that came from a donor, which I will explain presently the donor list. And this machine is yet to come. It takes about 6 weeks. It was paid about 4 weeks ago. And we presently have in country one PCR. We were one of 3 countries in the Caribbean that had a PCR machine. And we have a backup that we have been using with the HIV program. This one I'm saying for the first time to my Honorable Prime Minister. You tend to keep a couple backups to yourself. So we have a little backup there also. Obviously, that second one is not ours. With that said, we have been able also to start to procure the kits, which is the actual, what we call the tests. But on this test is dependent on 16 different items that go with this test, of which 3 are in demand, which would be the extraction kit, which would be the enzymes itself, and which would be the swabs. We have been through different ups and downs, not to the detriment of the public, because we are testing based on scientific epidemiological reasons. We have had a lot of demand from the public, but we have held our ground. Now, Dr. Manzanero has been explaining, he has been our face. He has done an excellent job along with his team, and I would want to think that we have given the right advice. So presently in the country, we have a total of 2,000 tests still from the old batch given to us by PAHO. We had used the 10 kits we had bought before from monies from the Ministry of Health and Finance and from donors, which would be equivalent to 1,000 tests, which we have to explain that when we talk about a test, we only use 60% of the tests in the batch. So if you hear me talk about 100 tests, I'm really only being able to do 60 tests. Why? Because I lose the tests on the retests and on the controls. So we have to be clear on that. So the numbers don't go 1-to-1. So I'll be very frank with what we have. We have the possibility right now in country, as I speak, to test a total of the 2,000 plus the 40 kits we bought, which would be 3,400, 5,300, and we are expecting, so we have 5,300 tests in country, and we are expecting 8,000 more from the 11 promised from PAHO, but expected, which they are going to donate, and we have paid from the Taiwanese fund that they gave us. We have paid for 50 kits more, which is equivalent to 3,400 tests. So I repeat, we have the capacity in country of 5,300, and we should have capacity once PAHO delivers their 8,000 and I receive the 50 kits that we have bought from the Taiwanese fund. We should be able to test 13,000+ more. Now, when we do the math epidemiologically, and I will leave the maths to my good friend Jules and Dr. Manzanero, the Prime Minister said the other day, we should be way above our testing capacity. Now, on the 3 items of the 16 supported items for us to test, which are the extraction kits, the enzymes, and the swabs, I'll give you news that I've not been able to brief my Prime Minister yet. I spoke with Amerijet on the tarmac at 9:30 this morning. I have received 16 more extraction boxes of 250. Those are 1-to-1. So, Jules, you can do the math for me. 16 multiplied by 250, those will go with the tests. I received also enzymes last week, Saturday, which were much anticipated. We received 8,000. So that gives me capacity to do 4,000 tests. And swabs, I will be as sincere as I can be. The adult swabs that were taken away from us last week, that were retrieved by our ambassador, again, I was told by Mr. Franco that Customs this morning now asked us for a certificate for those swabs. So we are hopeful that maybe Saturday they will come. But we do have the 2,500 pediatrics. So it goes to show that things are moving quickly, very quickly. So with that said and done, I would want to reassure that we have not gone unnoticed for the region, and we have not gone unnoticed within the Ministry of Finance or the Ministry of Health that holds us all accountable. And I want to make sure I don't go unnoticed to the Belizean people. And that's why I guess the Prime Minister instructed me to be here. Right, Jules? So, with that, sir, I have dispersed them.
questions, please.
Okay, thank you, Prime Minister and Dr. Goff. We'll now be taking questions from the media virtually. The same rules apply as standard press conferences. And Renee Trujillo, you'll be up first.
More? I don't want to get too close to Dr. Goff. I mean,
Are you there, Renee? Renee, are you there? Same rules apply as standard press conferences. And Renee Trujillo, you'll be up first.
Okay. 1 second. Are you hearing me?
Yes, go ahead.
Okay. PM, yesterday we listened to Dr. Manzanero and asked the expert, and he basically. Hi, you're not hearing me?
we are hearing you.
You're hearing me now?
Yes, yes.
I think I'm having a bit of a delay.
Renee, we are hearing you. We are hearing
Okay.
you.
Hi, you're not hearing me? You're hearing me now?
We are hearing you. We absolutely are hearing you.
I think I'm having a bit of a delay. Okay, so yesterday as the expert, Dr. Manzanero expressed some concerns over the fact that people are still not practicing social distancing, and basically that it was one of his headaches in terms of trying to seeing people on the streets basically not taking the precautions. I know with this ease and restrictions, I'm kind of wondering if there's some sort of gap in communication between the National Task Force and the Oversight Committee.
Not at all. Not at all. We certainly at the level of the cabinet, when we had the discussion as to how we should proceed on Tuesday, we never had the benefit of hearing personally from Dr. Manza, but I believe that the Minister of Health was able to communicate Dr. Manza's position to us, and we took that very much into consideration. When the National Oversight Committee met yesterday, we heard directly from Dr. Manza, and there was a full-fledged discussion about the pros and cons of what we were proposing to do. After listening very carefully to Dr. Manza, we took the decision that we did, which decision I have just earlier communicated to you. The fact that a lot of our people are still not showing the discipline required, are not adhering to the social distancing rules and to the other restrictions that the current set of regulations mandate, cannot, in our view, be a reason for not taking advantage of this little bit of breathing room that the statistics have given to us. Rather, we continue to try to message strongly to let people know that everything can be upended if in fact the indiscipline continues or becomes worse. And we take the opportunity as well to say that is why we are increasing penalties, including this mandatory jail time, certainly for those who go to the extreme of breaching the security at the borders, of insisting that they will not adhere to the requirement that they do not make any cross-border journeys. So there is nothing that is perfect in this life, and to use the old phrase, we were of the view that you cannot allow the perfect to be the enemy of the good. And so, with eyes wide open, it was, I repeat, the united position of the Cabinet and the National Oversight Committee to proceed in the way we have announced. The police, the security forces, are being asked to step up even more, if that is possible, the monitoring and the enforcement. But subject to that, and subject to continuing to try to hammer home to people the importance of sticking to those rules that remain in place, we are convinced that we're doing the right thing in proceeding. It's always been a balancing act. The economy is completely shuttered, and the sooner we can begin the restart of business activity clearly, the better it will be for us. And so I repeat that this is done on a considered basis, having regard to all the circumstances, but we absolutely are convinced that we're doing the right thing for this present moment in terms of the relaxation that I have just signaled to you.
Next question.
Circumstances, but we absolutely are convinced that we're doing the right thing for this present moment in terms of the relaxation that I have just signaled to you.
Okay, and then my only next question is that Dr. Mansa also expressed concern in terms of the borders up north, the illegal entries
Of the relaxation
up north, and basically warned people that the situation in Quintana Roo and over, our neighbors in Mexico in the increase of cases. What measures is the government taking to mitigate those illegal entries? Because he did say that there was a high-risk case in Corozal because somebody chose to go illegally over to Chetumal and came back home.
Well, again, Renee, I was very careful to stress that anybody who is caught doing that will now not just face a fine of $5,000, will, upon conviction, have to deal with a mandatory jail sentence of 3 months. Together with that, both immigration and customs, and indeed in particular the security forces, have been tasked with stepping up the patrols in those areas where we know that there is a frequency of illegal crossing. So it's a two-pronged attack: increased surveillance, increased monitoring, increased enforcement, and also this drastically increased penalty for those that are caught.
If he has no more questions, we'll now open it up for Paul from Plus TV. Go ahead, Paul.
All right. right. So, good morning, Prime Minister. Good morning to the nation. My first question, I think, is in line with a couple of the questions that Renee asked. But PM, how well have we been communicating the message that we are not in the all clear where COVID-19 is concerned, and that citizens should continue to adhere to certain established regulations such as social distancing and physical distancing? Have we done enough to communicate that message, which is essentially for our own safety? I mean, was the mandatory wearing of masks in public considered?
To answer your the first part of your question, we have certainly done our very best to stay on message where that is concerned. If you go back and you check, every prepared address that I have given stresses the need for us to adhere to the social distancing rules and regulations. Every time the Attorney General goes through the exercise of explaining each and every single provision in a particular regulation, the constant note throughout his explication is always, and if you breach these regulations, you are in fact putting yourself and everybody else in danger. Again this morning, I made the point, this is no time to be declaring an all clear or mission completed. No, I said this is an insidious enemy that can double back on itself and upend all the advances that we have made. So everybody needs to recognize that the social distancing restrictions are still in place and they must be followed. I tried to expand on that by saying it is not just that if you're entering into any public or private business, you must wear a mask. Inside the businesses, the staff, the managers must wear the masks. There must be the 6-foot space between members of staff. If you have a waiting room, you obviously can't have more than 1 or 2 persons in the waiting room, depending on the size of your waiting room, because you must have whoever is there sitting at least 6 feet apart. Now, I don't want to be appearing to blame the public, because the fact is that the vast majority of our people have been complying. It is just that recalcitrant few that no matter what you say, insist on going their own way and thus jeopardizing all the rest of us. Well, hopefully, once we put the first person in jail, that might have a salutary effect. Thank you.
Now, for my second question, Prime Minister, has to do with the economy. We've seen the economy take a huge hit over the past several weeks due to the many shutdowns of businesses and government offices. So my question is, what sort of stimulation, economic stimulation, do we anticipate the further opening up of government offices, statutory bodies, and private sector businesses? What sort of stimulation do we expect or anticipate that this will bring to the economy, stimulation that we definitely need at this time?
Not enough. That's the short answer to your question. Not enough. Look, it will take a long, long, long time for us to be able to recover to any satisfactory degree. Remember that the biggest contributor to our economy is tourism, and we certainly are not at a point where we can reopen the tourism sector. So what we're doing will provide some additional flow to the trickle of revenues that government is getting, to the trickle of income that private sector businesses are realizing, but every little bit helps. we have to make a start at some point, and that is what we're doing now.
Do you have any other questions, Paul?
Yes, and final question for me, Prime Minister, and I'll give my colleagues another chance, a chance to answer. But we used external coupled with internal data and studies, worldwide trends as foundations to bring the nation to a halt, to shut down the nation per se. Now, my question is, what external data studies are we using as a foundation to making these decisions of moving forward and opening back the nation, just considering that at this time, many nations are still in the hole and are not opening up as yet. And so we seem to be setting a trend. What are the external data that we're using and internal studies to make these decisions?
Well, I don't know that apart from looking at the situation of the international community and particular countries that are in particular situations and trying to see whether there are lessons to be learned, I don't know that we have proceeded on the basis of using any one country as a model. The New Zealanders, I believe, have declared that they have defeated COVID-19. We certainly are not there yet, but we look at where we are internally. That is why I took some time to do a little bit of research. I am no doctor, but I see what the literature says, and I noted that if you use the WHO certified benchmark in terms of the percentage of positives that you're getting back from your testing, their advice that if you get less than a 10% positive return, you are, for the moment, good to go, in my view, is certainly one of the driving factors in terms of, for me, the decision that we are able to reopen to the degree that we have. Please also recognize that this is not a case of throwing the doors wide open. There are still very many restrictive measures that remain in place. As I said, I didn't think I should go through the entire SI and draw your attention to all the provisions that are still there in full plenitude of strictness. The AG will do that this afternoon. But we have been able to go, or we have felt entitled, empowered to go as far as we are going, precisely because our testing, the mapping, tracing, random sampling exercise so far has shown that we are in a position where we are better off than most. We are not there yet. And remember, there's still much more testing to be done. What the Ministry of Health's team, what Dr. Marvin and the others are doing now, and Dr. Goff can perhaps speak a little bit more to that, is to proceed with the random sampling, beginning, first of all, with particular groups. Customs. Random sampling has started at customs. Random sampling has started at immigration. Random sampling has started with the police. Random sampling has started with the BDF. There's going to be random sampling at whatever old folks' homes there are in this country. And Dr. Goff can later on enumerate the full extent of the list. But the point is that the random testing will continue, and at a pace that is satisfactory, not to put it, not to engage in any exaggerated claims, but at a pace that is satisfactory for us to be able to say that our trajectory is absolutely in keeping with the international benchmarks and guidelines. Thank you.
Thank you, Prime Minister.
Okay, thank you, Paul. Now we'll have Tammy Acosta from TTV3. Tammy, we'll turn your mic on now. What we'll do is, we'll come back to you, Cammy. We'll go to Aaron Hughes now. You just got to issue the mic. Oh, Aaron, that's out. Marisol, you're up.
Okay, does that mean that I'm up next? Good. All right. Prime Minister, my first question has to do with enforcement along the blind spots. It appears to me that for the past period that has now gone, that wasn't being done in terms of having elements on the ground, including immigration, the police, the military. How do you foresee that this is going to happen going forward? I don't know how many blind spots there are, and I think the next part of the question should be for the CEO. If people are going across and coming over, will they be tested, placed under quarantine? What's going to happen?
Well, first of all, as the Minister of National Security tried to point out, we're limited in terms of numbers, both with respect to the BDF and to the police. I don't think we normally give out the size of the BDF for obvious reasons. With the police, we're 2,000, that's certainly not more than 3,000. So it's never going to be possible for us to keep a police presence or a security presence, security forces presence at each of these innumerable blind spots on a 24/7 basis. That we can step up a little more is undoubtedly the case. Another thing that doesn't happen that I wish would happen, no reports are made. There seems to be a kind of community wall of silence at these particular junctures where the blind spots are located. But again, that doesn't mean we sit on our hands. It means that we try as best as possible to contain these illegal crossings, recognizing that some people will get away from us. But we try to step up the monitoring activity, and I'm saying that there's a French phrase, in order to encourage the others, we shoot elephants or whatever in order to encourage the others. The moment we can grab somebody, and we actually have somebody in custody, or somebody was taken into custody, given bail by the magistrate, and then put under quarantine. Somebody who came in illegally across the Mexican border. But the moment, Marisol, that person was caught before the new SI goes into effect. As you all know, the SI only, in fact, becomes law on May 1st. But the moment somebody, such as the one who is currently under quarantine, having gone before the courts and been given bail, the moment we catch somebody like that after May 1st, I'm saying that that person will be taken to court immediately, and once convicted, will receive a mandatory minimum jail sentence of 3 months. Surely the demonstration effect of that will help us to contain, to some extent, these illegal crossings what's happening, the activity, the traffic at the illegal crossings. Oh yes, I'm sorry, Dr. Goff is making the point that that person that is currently not in custody, not in police custody, because the person was first taken into custody by the police, taken to court, charged. The magistrate gave the person bail. Health authorities gave her bail and released her into the custody of the health authorities, who put the person, who tested the person and put the person in quarantine. He tested negative, but he's nevertheless in quarantine.
Okay, so I'm going to leave a little bit more of that quarantine aspect to the CEO when I ask him questions relating to his portfolio, but I just want to end off all the ones for you, Prime Minister. Just two more. Was it a misspeak when you said 700 tests as opposed to the actual figure that we're getting through the infographics, which is close to 1,000?
No, I said 700, and I'm happy to be corrected, but remember, there's a difference, you know. There's a difference between the number of tests done and the number of persons tested. Remember that all these people, well, it's not all these because the number is pretty small, but there were those who were tested initially, proved tested positive. When they were recovering, after a certain period, they were tested again and proved positive again. Then they were tested again and they proved negative. And they have to be tested a fourth time because there must be 2 negatives before you are pronounced recovered. So there is a difference between the number of tests done and the number of persons tested. But if my figure, which is 700 persons tested, is a little bit off, then I would concede to that and I would ask Dr. Goff to give you the exact number of those tested. It doesn't matter because in terms of the positives, we're way below the 10%, which is the benchmark. But perhaps Dr. Goff can tell you exactly how many persons have been tested, not how many tests done.
Morning. We have a little bit over 700 people tested, but we have made close to 1,000 tests. Like the Prime Minister explained earlier, much of these people that are tested positive or people that are tested negative that have flu-like symptoms, we retest them. Remember that once we have a patient positive, we wait for the 14 days to retest them. And if they come negative, we still go back 24 to 72 hours to get a second negative test. So that's why you can see that percentage being lost between 700 plus persons versus 1,000 plus tests being done. But where I want to allude about the 750 were not the testing kits. It was the extraction kits. Remember I clarified earlier on. We have the testing kits which I spoke about, the 2,500 from PAHO in country, the 8,000 that has been promised that should come anytime. And then we had 40 kits of 100 which we bought from Roche for the PCR machine, which arrived in country last week, which is equivalent to about 3,200 tests, because we lose a percentage of the tests when we work the kits because of the retesting and because of the controls. So rest assured that we have enough test kits in country. Rest assured now that I mentioned this morning from Amerijet, I have enough extraction kits in country. Rest assured I have enough enzymes. So of the 16 components that work with the test, the 3 major ones in demand I have in country. So I have the capacity now to proceed with close to almost 5,000 odd tests. Now we're not going to test that amount of persons. We're going to establish, like what the Prime Minister alluded to early on, we're going to do random testing, and we're going to do it in a set of population that I think the Prime Minister articulated half of them quite nicely, and the other half is going to be people from our frontline workers that we have been working with, and people that obviously have been vulnerable to our COVID-19. For example, in all the flu clinics, all the ill cases, we're going to start to call them back, or the ones that are there presently. The hospitalized patient from SARI cases, we're going to be looking at them. The symptomatic healthcare workers, right? 1 in 5 asymptomatic, so we're going to do controls of the ones that work in the ICU. And the list goes on. For example, critical infrastructure workers, for example, in public utilities, the tourism sector, which the tour guides that had some kind of, the banking sector, the tellers, education sector, teachers. So we're going to be doing random. When I use random, if there's a population of 100, we'll do 5, we'll do 10. That's how we're going to start. Now, we won't be doing tests more than what we habitually have been doing. Maybe 20, maybe 30, maybe 40 per day. Because at the end of the day, we have to go by the percentages of our population. We have 350,000 people in this country. We have tested much below the 10% positive, right? We have the 700 cases of healthcare workers. So we have to make sure that when we go out there and do these testings, we do them based on where we suspect the risks might be. Now, I would want to pay attention to the northern border. I think that's where we'll probably go looking also. The same category of persons, immigration officers at the border, the policemen at the border, the BDF at the border, probably the people that we suspect that are coming and going, maybe 1 or 2 merchants, maybe 1 or 2 taxi drivers. I don't want to get into too much detail how it will be done, but the epidemiological profile is constructed based on our risks. That's what I'm trying to say. You heard me?
Okay, they unmuted my mic now. Completely understood. Prime Minister, the next question has to do with the very same concerns. Renee alluded to them earlier, what the Director of Health Services said about the movement being observed of people, and even now in the live stream, you're seeing people ask about going to the beaches and rivers and that sort of thing. Is there a concern for you in terms of the elements from the security forces that we have available to actually police? Because we're seeing that during curfew hours, there are still many arrests happening. That's one. And then the last part for you, Prime Minister, has to do with how do you see enforcement of social distancing or physical distancing on buses?
Your first question, there is no free-for-all, and there are still the restrictions in place that will prohibit bathing in rivers, going on that sort of an activity for recreational purposes. Again, with respect to enforcement, I freely concede that there are constraints. We don't have the size security forces, we don't have the numbers in terms of the security forces that we would like, but I am certainly convinced that the security forces, the police and the BDF and the Coast Guard, do a tolerable job. That there will be an effort at stepping up surveillance and monitoring is a given. But Belizeans also have to do their part. Lord, man, I don't know what more is necessary in terms of what people see on their television screens every day to convince them that this is an absolutely deadly enemy. The authorities are doing their part, and I repeat that there are very, very many Belizeans who are cooperating, very, very many Belizeans who take this thing seriously. I would go so far as to say the majority of Belizeans take this thing seriously. But for those who don't, please get with the program. if you're only going to jeopardize yourself, well, that would be unfortunate, but we could perhaps live with that. But what you do when you engage in the improper activity is that you also jeopardize the lives of others, including your loved ones. So we have to keep hammering home the message, and we have to do that in tandem with the stepped up activities from the security forces. Now, the last question you asked, I believe, was about the buses. That is problematic. We debated long and hard. We thought of perhaps limiting the bus operators to making runs with no more than half of the seating capacity on board. At the end, we spoke to Dr. Manza, and while it is not ideal, we came down on the side of saying, no, the buses can run with full seating capacity if they have to, and subject to the passengers needing to wear masks, subject to everybody having to come off the bus at every stop so that the bus can be disinfected and so that they can sanitize, so that they can wash their hands and do whatever is subject to that, and subject to nobody being able to board a bus without having first purchased a ticket. So you'll have to line up 6 feet apart, buy your ticket in the terminal, and then you get onto the bus in an orderly fashion, waiting your turn. It is not, as I understand it, what used to happen before, where people just rush onto the buses, and then after the journey starts, the conductor comes to you to collect or to get your ticket. Some structure, some order is being brought to bear with respect to bus transportation, but ultimately that in fact if you're a 60-seater bus and you go with all 60 seats occupied, there is in fact a sitting together without a 6 feet space. That is the fact. We cannot get away from it. On the other hand, because we're opening up, it's just not possible to deprive people of the means of public transportation. So it's a calculated risk that we decided we would have to take. Okay? Who next?
Okay. I'm sure there's going to be a discussion in that regard, because people will be frustrated, I think, by the whole ticketing system that seems to not have worked in the past. But beyond that, Dr. Goff, are you saying that there is going to be a protocol in place for when someone is detained at these blind spots to go into quarantine?
There is already a protocol, and there's also a legal structure for that. Unfortunately, sometimes we don't have the resources to have a public health official out there. So if we are not notified, and we are usually only notified by the ones trying to legally enter, and since there is a decree presently that nobody can return legally, only if they have a certain medical condition, then we are not notified. But in the case of this gentleman yesterday, or 2 days back, we were notified. We did swab him, we did test him, and then obviously there were 2 charges against him, and he probably got the easier charge because he got the charge of illegal entry and dismissed by or adjourned, and then we asked him to quarantine in his home because he was tested negative. Remember, the ones that test negative, we asked them to go home if they have the capacity to go home. Again, maybe on oversight, maybe he should have been put at a hotel at his own expense and held there for 14 days. We're trying to get it right. And I think what the Prime Minister said, come the 1st of May, there's going to be an even stricter legal structure in place that will trump ours. But yes, we are going to continue to test those that the authorities catch illegally entering the country. That I can guarantee you, those will be tested. I hope they're not much, but those will be tested to protect ourselves.
Okay. Last question, Marcel, and then we'll move on.
Sorry. For me? Not here.
Okay. So that's what I was going to say, Dorian. I have 1, 2, 3 more, and I was going to ask one and give someone else the opportunity. So the last one, if you do have the opportunity to come back, I hope you take that into consideration. About how many people, Dr. Goff, are asking to be tested. I'd say they would be begging to be tested if they are offering to pay or volunteer to test. At least that is what the Director of Health Services said yesterday. And why do you believe they're asking this? Is it because they have a suspicion of anything, or they just want to be tested?
Marisol, as you know, I'm not a media person. That is why Dr. Manzanero is my face, is our face, the ministry's face, the government's face, and obviously he tries to provide the best technical answers possible. I would want to think that we're all mindful that social media is one of our main forms of sharing information, right? And unfortunately in Belize, we share our affairs with each other, we share our doubts with each other, which is good. But at the same time, the Ministry of Health can only respond based on scientific evidence. We would want to assure the public that those who show up at our flu clinics and those who we go to their homes and we find that they're symptomatic with their flu-like symptoms, those that our physicians and nurses find that have similar situations that are clinically to even suspect a COVID case, those patients we test. Unfortunately, most of the time, when the patient comes to the clinic, he's probably a known asthmatic, he's probably a patient with a known pulmonary disorder, he's probably a patient with a little bit of anxiety. And that's why we have these flu clinics, because there is a certain design in the questioning that the doctor and nurse does. There's a certain design in how we test for their temperature, their vital signs. And in that screening process, we proceed to make that decision. It's not based that I don't like you, or we would not dare have a patient that we clinically see at our flu clinics sent home just because we don't want to test them. In fact, that is our biggest fear. But we have designed these flu clinics. The Prime Minister has been very generous. We have gotten 6 houses paid by the government of Belize, 1 house from a donor, and these are all 20 by 40 homes, fully finished, $50,000, $60,000 each. And we have also gotten 3 from the Lord Ashcroft Fund. So the government now sits with multiple homes in all the districts, in all the hospitals as flu clinics, beside the temporary infrastructure we had put in place. So we are in no time in the next 2 to 3 months are going to close these clinics. These clinics are on top of the demand that we do for primary care, that we do for NHI clinics in the south, in the north, and in Belize City. Those clinics continue to run. This is beside the care that we offer in the hospital. This continues to run. This has put a drain on us in such a way and put a demand on my staff when it comes to human resource, because now we're manning on 3 fronts. So yes, we are going to try to test, but we cannot test based on that type of demand. Now, the Director of Health Services has shared with the Prime Minister and the Oversight Committee is that once the FDA in the US should vet a rapid test system, we will be the first to encourage it, because that would allow us to know who have been exposed and who is actively ill. But presently, we continue only with the PCR because that gives us a level of specificity that protects us. So I am not answering your question. I'm trying to defend why I'm not going to answer your question. We cannot test everyone, Marcel. We cannot. We simply cannot. We can continue to see them at the flu clinics. We can continue to examine them. And you will have to trust us. You know, remember when me and you get on a plane, we trust a pilot. When I go to the bank, I'm trusting the banker. When I go to a lawyer, I'm trusting the lawyer. So you all will have to trust that we are going to test those that we clinically believe have a valid reason. We might be wrong at times. We might make a mistake at times. But so far, I think we are doing our best. And so far, we have tried very hard to explain to Belizean people that rapid testing at this time is not the way to go, because we are going to have 15% walking around thinking that they are negative and they're actually positive.
Thank you. Thank you, Marcel. We'll now go to Tommy Augusta from KTV3. Tommy, you're up next. Tommy, you can go ahead. Tommy, do you have a question? So if not, we'll go to Isani Kaitano from Channel 5.
Thank you very much. They've answered the first part of my question. The PM has done so. But my second part, PM, there is concern at the moment here in the north when it comes to the monetary and the food assistance reaching residents, especially those living in the rural areas along the river, where we're hearing that a number of illegal points are and people crossing to the Mexican side. Is this something that can be looked into in order to reduce the movement into Quintana Roo at this point in time?
Well, there is already, I believe, the start of a distribution program in the context of the food assistance rollout by the Ministry of Human Development. There's already a start of a distribution program in Orange Walk Rural. What has happened is that we have been able to cover, for the most part, all the urban areas. The rural areas naturally are proving far more difficult because there are, in several instances, not the grocery shops available. In the urban areas, we're able to partner with the grocery stores. So you don't have that number of grocery stores in the rural areas, and a lot of the grocery stores that you do have don't have the commodities that ought to make up a decent and sensible food basket. So in those villages, the distribution will have to be done manually by way of assistance from NEMO, from the Red Cross, although I gather yesterday from the CEO of the ministry that the Red Cross wants to do its own thing. But certainly NEMO, the security forces, and as has happened in Toledo, any NGO operating in the area that can assist. So absolutely reaching the villages, and in particular the remote villages, with the food baskets, hopefully will also act as an incentive to stop people from the illegal crossings. I take your point that to some extent people are going across in search of food. I don't say in order to contraband and to sell here in Belize. In some cases, I'm sure it's just a matter of needing to feed themselves and crossing illegally because the food that they want is available in Mexico. But to recap, definitely the rollout is starting in the Orange Walk district, in the Orange Walk Rural, and that I believe, should provide some assistance, should go some way towards helping to contain the illegal crossings.
Okay, do you have any other questions?
Thank you, PM. That was my only question, Dorian.
Okay,
Thank you.
thank you. We'll now move on to Attorney Cayetano from Channel 5.
Yes. Good morning, PM.
Good morning.
Good morning, CEO. My first question has to do with the issue that was raised in Wednesday's newscast in respect of an interview that was conducted with the Commissioner of Police in respect of the state of emergency and, of course, the way the San Pedranos are treating with the regulations of the SOE, particularly the town council. Can you provide us firstly with a position on this matter? I gather that the Compol has spoken with the area representative, Minister Heredia, but perhaps if we can get in a way in from you.
Absolutely, Sani. I'm very sorry to say, and it really grieves me to have to publicly make the point that what the San Pedro Town Council and the area representative are doing is absolutely improper. And I said that to the area representative during the course of the cabinet meeting on Tuesday. I was presented with some sort of official bulletin that on the face of it said it was being issued by the mayor of San Pedro, the area representative for Belize Rural South, and the local emergency operations center in San Pedro. And they purported, in fact they expressly declared, that they were modifying the regulation that is currently in place, and they were altering the measures set out in that regulation. I made it crystal clear to the minister that that is illegal. You cannot operate out with the law. I sympathize with their motivation. They think that they should go above and beyond what is set out in law as obtaining to the entire country. And when the minister is in fact put on the spot in that regard, he says, well, but the people in San Pedro, the people in Ambergris-Key are in total solidarity with what they're doing. I don't know about that. I've not taken any poll. I know that there are people in San Pedro, in Ambergris-Key, that have been complaining to us about the fact that the local authorities seem to think and indeed act in a way consistent with that attitude on their part. They seem to think that they can do as they please. I repeat that admittedly their sentiment, however misguided it is, comes from a good place. But we cannot allow that to continue. So I've said to the minister, and I'm sure he will pass the message on to the mayor, that please cease and desist. Otherwise, we will have to instruct the law enforcement authorities on the island and in the town to carry out what will become necessary or what is already necessary under the law. So I hope that in fact the minister will understand that it cannot be as he and the mayor and this emergency operations center would want it to be.
My second question.
Yes.
Okay, my second question. There seems to be a disparity in the number of applications for relief assistance versus the actual recipients who have been able to access this particular program. Does this raise any concerns in terms of perhaps the scrutiny of the applications that would allow for one to actually be eligible to receive this kind of assistance at present?
No, what you talk about is a little bit of a lag between approval of an application and the actual payout. A little bit of a lag is to be accepted. There is the approval, and then the approved list is sent to finance. Finance then has to see what the quantum is that's required to pay those on the approved list, and then finance sends the money across to SSB, and SSB then, where they're able to, deposits the money in the accounts. So in the normal course of that sort of a process, there will be some little lag. But in addition to that, people make mistakes. The banks often send back to say, no, there is no such account number, or the name that you've given us and asked us to credit monies to that person. That name, we have somebody with a similar name, but it's not spelt in the same way. So there are those sorts of issues that crop up that would then mean that the committee has to go back and get in touch with the person whose account is not able to be credited, either because there's not an account, he's given the wrong number, or because he spelled some name wrongly, or some particular is inaccurate, and redo that so that then the correct and accurate information can once more be transmitted to SSB and to the bank in order to complete the transaction.
My third question, PM, with the ease in some areas of the state of emergency going forward, most of us will be heading back to work as of Monday of next week. And we note that the livelihoods of other persons who provide, for instance, vending services for us, for those of us who work in the offices and what have you, their livelihoods has been put on hold as a result of the outgoing SOE, if I may. Will they be allowed to now go back to their form of livelihood in terms of either selling foods on the street side or providing that kind of fast food for persons to access during the next 2 months?
No, sir. No, sir. Not the fast foods, street corner vending. We're sorry, but again, the advice from the health professionals was absolutely that cannot be allowed to happen at this time. There is, as somebody earlier alluded to, sometimes a little bit of a difference of opinion between us who ultimately are the policymakers and the DHS and his team, but no serious divide that we are not able to talk through. With respect to street vending, there was complete unanimity on the part of Cabinet, on the part of the National Oversight Committee, complete agreement with the advice of the DHS and his team that that kind of street vending cannot be allowed to take place just yet.
And my final question has to do with the tourism industry. It being arguably the bread and butter for most of us in the country. When the tourism season reopens later in the year, along with the opening of the airport, will there be measures, specific measures put in place going forward in terms of either being able to determine the body temperature of the passengers alighting or disembarking onto Belize, and what measures are foreseeable in terms of the tourism industry and being able to look at the safety of citizens as well as passengers, but being able to rebound in terms of the tourism industry on a whole?
Well, your last point about looking at the safety of passengers and looking at the safety of Belizeans is very valid, and that is why, in terms of the phases of the reopening, the phased approach that we're pursuing, unfortunately, tourism is the last in terms of the easing of the restrictions against the entry of tourists into Belize. That comes last. We are hopeful, as Dr. Goff reiterated, that there can soon be an acceptable rapid test that would then allow us to be able to administer the test to every visitor that's coming to Belize. Short of that, it's going to be a while, because that temperature gun thing, Dr. Manza and others have told us that that really doesn't work. That's maybe, I don't want to say that it's not like the current rapid tests that give you all these false negatives and so absolutely skew the picture in a bad way. What I understand from Dr. Manza is that there's nothing accurate about these temperature guns. A lot depends on what the travel conditions were. If you were cooped up in the cabin of a plane for a long time, that can, as it were, interfere with the result, so that you don't, or with the accuracy of the result, all sorts of things. If you're standing up out in the sun, because in the old days there were long lines of tourists waiting to be processed, that can interfere with the accuracy of the result. Bottom line, long story short, there is not, from our medical experts, any conviction that the temperature guns, the temperature gauges, can act as any sort of safety measure. So it strikes me that we'll have to do some additional thinking, but for now, I don't see us reopening the airport anytime soon, and our best bet for an accelerated opening is the certification, the approval of the rapid tests by WHO, by the American Centers for Disease Control, by the Food and Drug Administration in the US. Remember that 75% or so of our tourists come from the US. And as long as there are all these states that continue to see a proliferation in the COVID-19 cases, we will have to be very careful. We can't do all that we've done here. We can't take the limited risks that we are taking now, come out of that still relatively intact, and then take a chance on throwing it all away by allowing into the country a bunch of people that may be infected, even if they are asymptomatic, unless we have some almost surefire way of being able to determine their status. And I repeat that it is the hope of all of us that that kind of device will soon, very soon, become available. But until it does, I do not at this moment see the reopening of the tourism industry. I hope and pray that by the end of June, surely, not only will the rapid test kits be on the market, but there will be enough for small countries such as ours to be able to purchase. Remember that when the CEO told you about what happened with our swabs and what is still happening with our swabs, what that meant was that swabs we had already paid for, which were put in the custody of Amerijet to come to Belize, were detained by US Customs, taken off the plane. When our ambassador inquired, he was told that, well, they have not been confiscated. They are merely being detained. Afterwards, as he continued to press the case, he was told, well, they will be released. Now we hear another story that, in fact, they have not been released, so we are still waiting to see when the swabs will come. We have asked Taiwan for some swabs. They don't manufacture. They import. But they, it appears, are prepared to send us some of what they import for their own use. The fact is that we are caught by these export restrictions, and we must then understand that if the rapid test comes to market, we will have to join a queue. The US will absolutely impose, if they're made in the US, impose restrictions on the sale of those rapid test kits to countries outside of the US. Even when you place orders from agencies not in the US, if the route of supply to Belize passes through the US, you still run the risk of having your supplies either detained or confiscated. It's a terrible thing, but I didn't see that it made any sense to complain, to alert the public when it happened that this had in fact taken place, because we were trying to work with customs authorities. Ambassador Guterres did say that the US Chargé d'Affaires, Mr. Gilges, was trying to be helpful, and because there were other items that appeared on the so-called export restriction list of the United States that we needed to get, it didn't strike me that it would be in any way profitable, and it would be counterproductive to appear to be denouncing the US. But it does hit us hard. Swabs, basic swabs, they take off. The case of ventilators, what we had to do, there are ventilators, if they're not here yet, that are coming. I think they may already have come in. What our ambassador had to do was to ensure that they be put on a ship. So they had to come by sea voyage, because Amerijet wouldn't even touch them, saying that there is distinctly an edict from the US government placing ventilators on the export restriction list. But we found a way, and I think those additional ventilators are here. Sorry for the for the long answer, but I think it critical so that we don't raise any false hopes, we don't create any false expectations. Hopefully there will be the rapid test available, and hopefully there will be a mass manufacture of those rapid tests so that those of us that can't purchase from the from the United States immediately because of their export restrictions will be able to do so in a fairly timely manner. I should tell you as well that, you know, we placed these orders a long time ago. It is not that we just throw up our hands and say there's nothing we can do. Take the case of the Ashcroft Foundation. As far as I know, up to this point in time, what we have received from them, 371,000, that's all. And why? Not because there was any unwillingness, but initially, when Dr. Goff and the Financial Secretary met with the Belize Bank Committee and presented the list, they were told, well, listen, the foundation felt that it could do a better job of sourcing the equipment and the supplies. The foundation has not produced one of the pieces of equipment or the batch of supplies that they thought they could source more easily than the government of Belize. So what they've paid for, Mennonite houses, and some of what we sourced and have been able to get, they have paid for. We have committed to another, I think, $2 million, but again, it seems that that will have to proceed on the basis of our identifying and bringing in the products, and then they will give us some sort of a reimbursement. I say this not to complain, I'm stating a fact, but to make the case that government is doing its best to source these supplies effectively, and nobody but government. Or put it another way, nobody can do a better job than government in this regard.
Okay, now we'll have Jules Vasquez from Channel 7.
Government is doing its best to source these supplies, but government.
Jules, go ahead.
Yes, I'm up. I'm up.
Yes, sure,
okay.
Sir, yes.
First of all, I want to congratulate the press office. I know it's not going seamlessly, but it is a technical accomplishment to merge all these different online interfaces for a virtually seamless press conference. So a big up to all those guys at the press office. Thanks for this. If I could continue on a subject that Isani had raised about tourism, I know that you said that no flights anytime soon, understood. Are you able to address the issue of whether we will be allowed to, I'm not sure you addressed this in the introductory remarks, whether Belizeans will be able to do inter-district travel? Are we encouraged to be too rich in our own country now so that the hotels can get some sort of revenue? And also, is the government contemplating any type of assistance for hotels, being that in the medium to long term, any economic recovery will be built upon the success of these hotels? We know that it's, half of the GDP, the tourism sector, and I don't think that's going to change. And then the third inter-subject in there is that while you said the airport will remain closed, and it's a subject we have raised with you earlier this week, will there be repatriation flights? Is that something that is within the realm of contemplation?
Repatriation flights for foreigners wishing to leave Belize, not repatriation flights for Belizeans wishing to come home. We can't afford that. And indeed, if we reach the point, and we must reach that point at some stage, where Belizeans are allowed to come home, they will of course have to undergo the mandatory quarantine for the 14 days that the Ministry of Health has decreed. But we don't see that we are in a position to do what the Americans are doing. I believe some other flight is coming in next week, arranged by the State Department, presumably, to airlift Americans who are still stuck here out of the country and back to the United States. In terms of tourism, the hotels now being open, well, I'll tell you, one of the first triggers for consideration of that was the fact that BEL in particular said to us, listen, all that's happening with the fires and with the dust and the way their wires and the poles are being affected, they need to conduct some sort of a countrywide maintenance repair program. And when they send out their people, they can't send them out just for a day at a time. They want to send them out to spend maybe in some cases up to a week, and their people need a place to stay. So that played right into our hands. That then made us know that we were absolutely on the right track in determining that the Belizean hotels, or that the hotels in Belize could be reopened to in fact accept local traffic. And since we are saying that anybody can move across district lines in order to attend or in order to seek the services that are available, that are legitimate, and local tourism services are available and legitimate, then it must mean that indeed, if people want to travel to San Pedro, if Minister Heredia and Mayor, what's his name, Guerrero will permit, they should be free to do so. There will still, that's why we said that the restaurants can't be open for in-restaurant dining. People would have to settle for a room service, and the hotels would have to be very careful with respect to the question of the use of the pool, that sort of thing. But in principle, the answer is yes to your question as to whether Belizeans would be able to, in fact, travel across district lines to patronize, if you will, the hotels that are now being allowed to reopen. In terms of any help for the tourism industry when we reach that juncture, well, let us wait and see. The difficulty is that when people ask the government for help, they forget that the government itself is in need of help. We are all over the place, as you know, scrounging and scrambling for monies from these various international financial institutions. But depending on how far we get, it may well be that we can offer some small stimulus package to the tourism industry. It's not a commitment. It is perhaps no more than a pious wish on my part, but I certainly want to signal that if that possibility materializes, we will be good to go with respect to trying to assist the tourism industry. We can offer some small stimulus package to the tourism industry. It's not a commitment. It is perhaps no more that if that possibility with respect to trying to assist, we can offer some.
If I can ask about the borders, regarding the borders, I know a lot has been said about the north, and we know that is one of the main sources of contraband. And I hear all the penalties for there, but I know the penalties will also necessarily apply in the West. But would you speak about the borders, the issue the issue in the West with people coming across? We know that there is a little bit of a particularity about the West, where the communities of Melchor and Benke being much closer in physical proximity than those in the North. You know, the communities of Melchor and Benke are right beside each other. Arenal, it's a football field, as we know. So these communities live almost intertwined, and the movement across the borders is a lot more straightforward, or a lot more on a day-to-day basis. So will there be more active measures to crack down over there? That's number one as regards the borders. Number two, as regards the borders, what is the status of the Corozal free zone?
Well, in terms of Melchor and Benke, unless things have changed, I recollect seeing that there was a protest on the part of the Petaneros in Melchor against the entry into Guatemala of Belizeans. That was some time ago, maybe 2 or 3 weeks. But most recently, as we have been pursuing our inquiries about the illegal trade in cattle and whether the Guatemalans would in fact be prepared to allow that to continue. One of the answers we got back via Ambassador Rosado was that the answer was an absolute no, and officials in Guatemala City were saying that it couldn't be otherwise because the Petaneros are now absolutely zealous in trying to ensure that there are no crossings of Belizeans into Melchor or farther up into the Petén. I also know that at one point security forces were dispatched to some crossing in the area of Arenal, where I was told there's some kind of a footbridge, and the Guatemalan military actually erected barriers on that footbridge to take it out of commission in order to stop the free flow that formerly used to occur between Guatemala and Belize at that particular juncture. So the difference between the situation with Guatemala and that with Mexico is that the Mexicans still have open borders. So if you can, people will be able to walk across legally if it weren't that we have said we prohibit or restrict that kind of movement. In Guatemala, as I said, it's different. On their side, they are doing all they can to stop it. So it should be less of a problem with respect to the Guatemala crossings than it is with respect to the illegal Mexico crossings.
Okay, I'm not sure if you addressed the issue with the free zone. I may have missed it while I was putting on my headphones. But moving on, if we could ask about the situation with schools. I know that we haven't heard anything about that, and the understanding is that school will not resume at this time. Is there any contemplation of this changing within the 60 days, the prescribed 60 days extension on the state of emergency?
I don't think so. I believe the school year would normally come to an end in June. Is that correct? So I don't see school reopening until the start of the new school year, which is August or something like that. That could change, but my personal opinion is that the rest of this school year is shot.
Okay, and then if I could just shoot in one more question. I know I've expended 3 questions, but if I could shoot in one more real quickly. It's for the CEO, for Dr. Goff. We know that last week was Laboratory Professionals Week, and we just wanted a statement from you on what pertains as regards the activities of the laboratory professionals. We know that they had a party at the blood bank on Friday, and I'm sure that no one has been in the country under more stress than they. But I'm told, I know the premises of the blood bank are not expansive, and there was a party in there where reliably informed social distance was not observed, and it was a quite robust social affair. Were you aware of this, and are you able to say anything about it? If they are exempt from the prohibitions?
Jules, I want to be kind. I want to be kind with you, but also kind with my staff. To answer the question, no, I was not aware of the social gathering. But I would want to say one thing, that we were aware of the week of the lab technicians and the lab workers. We were extremely generous with them because that week was in the plain week of the curfew and the containment, where all the food premises were closed. I was a bit generous with them during the week. I made sure, instead of providing the one single meal that we give the healthcare worker on a 12-hour shift, we provided 2 meals for that week with some refreshments. So I did have a small budget put aside to take care of them for the full week, from the security guard right up to the acting director. The total staff of 45. At any given shift, at any given time, there's probably only 12 to 24 people in the building. So if there was a social gathering, I was not aware of it, but I would want to think that you would be easy on that one. They have been our guardians, and they have been working the last 3 months, night and day. So I don't make any apologies for them, but I was not aware, Jules. So, thank you.
If we have no further questions, that there brings today's press conference, today's virtual press conference, to a close. Thank you very much for tuning in. Thank you, Prime Minister. Thank you, Dr. Goff. Have a nice day.
Thank you to everybody. Thank you.